Good evening all, I'm Aditi Lamba. Welcome to our special report, Coronavirus Pandemic on Vision of Asia. This is the Thursday night episode. We're coming to you from our studio located here in New York City. Hope you're all staying well and also taking care of yourself and others around you through social distancing. Tonight, as we speak, the rate of cases in the United States is on an exponential increase, and literally the only way to combat it for doctors and for healthcare workers to truly take care of the critically ill, we all must do our part and stay inside and stop the spread. As a media house which is still currently filming, we also request you on behalf of our team to practice social distancing and help flatten this curve of this disease. Today, Director of National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, said that the country can avoid reaching a milestone number of deaths by taking aggressive measures, saying that it is within our power to modify these numbers, which are predicted to be more than 100,000 deaths. The key is mitigation and a strong push for it based on model predictions. While we discuss this, U.S. jobless claims topped 6 million today as jurisdictions have enforced stay-at-home measures to curb coronavirus pandemic. This pandemic is altering life as we know it. Almost 1 million global cases and over 47,000 deaths globally. Countries such as Italy, Germany, India, the UK have all had their countries on a lockdown to get through this peak period of the virus. In India, 1.3 billion Indians have been put on a 21 days lockdown with visible social as well as economic impact on world's second most populous nation. Here is a little glimpse right now of New York City under the lockdown. It is the emptiest we have ever seen the Big Apple. Reporting to you from New York City, everyone. Welcome to ITV Gold. We are here in New York City, and currently, as of March 22nd, New Yorkers must stay at home. This is an order that's come from Governor Andrew Cuomo, and we are talking about New York City basically going into a lockdown, a shutdown. They're only asking essential workers to come outside and go to their work, which includes many of the healthcare workers, other people that are working for the government, us who are in the media, and several others. But most of the New Yorkers must stay home. So stay tuned with us as we bring you so much more insight into what's happening in New York City. And if you are in New York or other areas being told to stay home and stay well, take care of yourself. On this episode, we have tonight exclusive conversation featuring Indian Consul General Sandeep Chakravorty from New York City tonight, along with prominent doctors on COVID-19 impact measures and updates. Here are the headlines. Consul General Sandeep Chakravorty exclusive on India's response to COVID-19 and 21 days lockdown. ITV Goes Skype. Dr. Janish Kothari addresses South Asians on coronavirus measures and updates. ITV Goes Skype. Dr. Purvi Parikh addresses coronavirus pandemic facts and advice. ITV Goes Skype. A lot more on the other side of the break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. Welcome again, I'm Aditi Lamba and this is Vision of Asia, Coronavirus Pandemic 2020 edition, Thursday night episode. Let's begin by taking a look at our conversation from earlier this evening with Consul General of India, New York, Sandeep Chakravorty, who joined us via Skype on a 1-hour live call-in segment addressing Indian Americans on measures, updates, as well as impact of COVID-19 in India and here. For emergencies, do contact the 24/7 consular emergency helplines at the embassy and consulates located across the country. Also, to help support Indian students during COVID-19 crisis, the Embassy of India Student Hub has now established a non-emergency peer support hotline. For all these details, please visit indiainnewyork.gov.in for all numbers and more updates and information. Prime Minister Narendra Modi has ordered this lockdown of 21 days in India, strict banning of travel or community in world's second most populous country to contain this virus from spreading in India. 1.3 billion Indians we have been asking to stay home and help curb the spread. The country is currently facing several economic as well as social impacts, which the Consul General reflected upon, as well as bringing us all the latest statistics and updates on India's fight against coronavirus. Also addressing the NRI and Indian American community here, he asked for patience of everyone and to practice social distancing and give both nations the time to make accurate measures to protect everyone. Here is our conversation with Consul General Sandeep Chakravorty. Welcome to this edition of ITV Gold Live. We are presenting our special report for this hour focused on coronavirus pandemic's updates, impact and measures, especially when looking at India and Indian Americans. We are honored and privileged right now to be graced by none other than Indian Consul General of India, New York, Sandeep Chakravorty. He has joined us again on ITV Gold Live. This time via Skype, he's joining us from New York City itself to talk to us about what's happening with this 21 days ban with India and a lot that's happening with the Indian consulate here and much more for the Indian American community. So let's welcome on the show. We're joined by Consul General Sandeep Chakravorty. Thank you so much for being with us on ITV Gold, sir.
Namaskar. Happy to be back on ITV Gold, and as we are all advised to stay at home, I'm connecting to the studio of ITV via Skype, so I'm trying to follow the advisories and instructions of our authorities.
Definitely, sir. And we want to let everyone know that this is a live call-in show, so you can speak to your Consul General. Just dial 718-784-8555, extension 108. Sir, while I have you on the show, I have to begin asking you, so much has changed since the last time we had you here in our studio. Stricter measures, a 21 days lockdown in India, so much happening here in the United States. I would like to know, how are you doing and how is the Indian consulate doing right now? I know you are open 24/7 as always.
Yes, you see, we representing India in New York and also dealing largely with the Indian American community, we are doubly affected. We are affected by what's happening here in New York. We are affected by what's happening to the people who live here, the Indian community and the community at large. And also we are influenced and impacted by developments in India. And I think there has been no other phenomena or no other such development which has influenced and impacted our lives as much as COVID has. It has really brought the world to a standstill. Yeah. And disrupted so many things. We have been talking of disruptions, of technology disruptions in the past, but I think COVID has been the most incredible and unbelievable disruptor for our normal life. So what we are trying to do is, first of all, trying to be safe. And I would take this opportunity to request all the viewers and listeners of ITV Gold to be safe. Follow the instructions, stay where you are, stay at home. You are the safest at home or wherever you are. If you're in a hotel, some of our people are stranded here. They're in hotels or they're in hostels, in dorms. Be where you are. I think the virus doesn't come to you unless you go to the virus. So be safe, be where you are, and follow the instructions of your authorities, of your local authorities. I think that's the only thing we can do because if you are struck by COVID, then there is a protocol to follow and things to do. But the best thing to do is not to get infected with the virus and be safe. Be safe. What we are trying to also do is adapt to the new way of life. We are trying to do things online. We are trying to use our media platforms in a larger way. And I'll tell you later how we are trying to become an online consulate and do events and activities online and connect to people, which is what a consulate should do. Earlier, we were physically connecting to people, but now we are virtually connecting to people.
Definitely, sir, and we want to go more into it, but just starting this off and going a little bit deeper into the concerns of Indian Americans, I do want to look into India and ask you more questions on the Indian government's proactive measures and the steps that are being taken place there. But before that, Indian Americans, there have been a lot of concerns. I know the consulate has been getting a lot of calls. My first question to you is, it's actually an anecdote we found somewhere. It says, Balaji is among thousands of Americans that is in India right now that the US State Department is trying to bring home as the air travel is shuttered by global coronavirus pandemic. Still, the thought of returning back here to Pennsylvania where he lives brings its own sets of concern. Could you reflect on those Indians that are currently in India? I'm sure there must be so much information you must know in that regards.
You see, there are two aspects here. One is Americans who are in India. Right. But we have to remember always that number of American citizens in India is very small compared to the number of Indian citizens in the United States. In fact, the numbers are so strikingly different that we can't even, it's not only apple and oranges, they are they are like peanuts and watermelons. They are just we cannot even compare the numbers.
Right.
Secondly, we have to understand that entire India is under lockdown.
Yes.
Whereas in the United States, so far, large part of the country is under lockdown, but there are still areas which are not under lockdown. So when the American government is evacuating people from US citizens, they are evacuating a smaller number of people and they are taking them to places which are not under lockdown. As far as I know, some of the flights will come to Salt Lake City, which is not under lockdown. But for us, the challenge is enormous. At the moment, no evacuation flights are planned. Also, you have to understand that it is a problem which cannot be solved by evacuation flights. How many people can you evacuate? The numbers are in hundreds of thousands, if not millions.
Right.
Secondly, who will you give priority? There are all kinds of people who are here. There are students who are here. There are tourists who came here. There are elderly and sick people who came from India to spend time with their families, and they are stuck here. So there is an entire gamut of such people. There are people who came on their job. They will, unless they go back to India, they will lose their jobs.
Yeah.
Those people are stuck up. So
That's
at the moment,
sure.
I think the best thing to do is to stay where you are and just wait for the suspension of flights to be revoked. And when commercial flights are resumed, you take your flight back and go home. But at the moment, we are not talking of evacuation flights. If somebody is in need, please reach out to our consulate. We will provide you that support.
And we have now another exclusive interaction on ITV Go Skype featuring young South Asian American doctor Purvi Parikh, who joined us earlier for this evening from her New York City office. The known expert in infectious disease and immunology and allergy, Dr. Purvi Parikh provided much insight into COVID-19 and its impact on at high-risk patients, especially asthma or allergy sufferers. Applauding the unity in the medical community, she also reflected upon the great need of PPE, personal protective equipment, and other areas of healthcare that is concerning medical professionals nationwide. They are saying it is a war zone and medical professionals and healthcare workers are on the front line, all asking everyone to stay inside and help contain the spread. Current figures read more than 200,000 cases in the United States. Here is Dr. Purvi Parikh, a much insightful interview with details, tips, appeal, and much more on the virus itself. Currently, we have with us Dr. Purvi Parikh, who's joining us from her office in New York City via Skype. Here is hoping to getting even more information, latest updates and information. Let's welcome on the show Dr. Purvi Parikh. Thank you so much for joining us.
Thank you. Thanks for having me.
Of course, and I truly appreciate your time and your efforts. As a doctor, first I want to really showcase my gratitude and really thank all of the frontliners, just as yourself. Dr. Purvi Parikh, we're looking at today's Thursday, and a lot has happened this week in terms of research, in terms of finding out about cases, in terms of the panic and fear. Right now, the stats I have say over 215,000 cases in this country, over 5,000 deaths in the country so far. I know you have some current updates and latest information. Wanted to open up the interview to that.
Right. So, I mean, there's a few things. I know the numbers are very scary,
Yes.
and everyone should take it seriously because it is very contagious. Many people are being affected constantly. The good news is the majority of the cases are people that are in the process of recovering. And even though there's 5,000 deaths, there's close to 8,700 people that have fully recovered, which is nice. So that's some good news. The rest, though, there's almost 10,000 that are hospitalized and still recovering. Some new treatments that are on the horizon is for using patients' antibodies that have recovered and using them on sick patients. So basically using the blood and plasma of recovered patients and giving that immunity to very sick patients. So some hospitals in New York have started, as well as other sites around the country. And then finally, some surprising news that the medical community got is that we're seeing very young patients affected. The first baby, unfortunately, passed away last night, only 6 weeks old. And that's puzzling to all of us because until now, we thought, babies and children weren't as badly affected.
Correct. And do we know, Dr. Purvi Parikh, right now, what exactly caused it? Was it COVID itself fully?
Right, so that's a very good point. We don't know that it was COVID that caused the child to pass away or if it was just a coincidence, because
Right.
we do know that many people are going to be testing positive for COVID, but they might not have any symptoms. And many people might have mild forms of disease. So they're investigating it further. It may have had nothing to do with it or something to do with it, but time will tell.
Right. You know, Dr. Purvi Parikh, while I have you, I really want to discuss something that's very major in terms of coronavirus right now. What we're looking at, the peak that they keep on saying is going to happen in mid-April. We're looking at April 15th as the date. You know, a lot of audience is asking this question about what do you predict will happen during this peak? And what does that mean when we're looking at in terms of sick patients, in terms we're looking at PPE, we're looking at hospitals and beds. You know, where do you see the hospital capacity or just the capacity to take care of patients during that time period? We're very close to it right now.
Right. Right. No, it's worrisome because many of the hospitals in New York and New Jersey are full. Some in Bergen County are so full that they're having to turn patients away. They're diverting patients. So it is concerning because we're not at the peak yet and we're already full and running out of resources. So I think more drastic measures will need to be taken in the next few weeks. There's talk of completely stopping air travel, closing airports. It's terrible, but it might be a good move. We might have to get much stricter with the social distancing.
Right. So assume we hit April 15, Dr. Purvi Parikh. I want to know for our audience watching, what will happen during that time period? And, you know, what happens in 2 weeks? What happens in 4 weeks? Where do you see, you know, the concerned patients sort of, you know, come into the spectrum? Who is really at risk in the next 2-3 weeks?
Right. So, you know, the most at-risk people are elderly, those over age 60. Certain chronic conditions put you at higher risk, like diabetes, high blood pressure. If you have any lung conditions like asthma or COPD, and then also if your immune system is weakened, you're at higher risk if you have cancer or an immune deficiency. But the thing is, we're actually seeing a lot of healthy people hospitalized and sick too. So it's not just protecting others, you really need to protect yourself too, even if you have no medical problem.
Definitely. And in terms of discussing a little bit more about lungs, since you are an allergist and immunologist and your expertise is in infectious disease, Dr. Purvi Parikh, have you researched or found more details and more current updates as to what exactly is it doing to the lungs? I know a lot in the news is about it making these sacs in the lungs, causing pneumonia, but for our audience that is still trying to understand, there's so much uncertainty about what is exactly happening to the lungs and they're just collapsing. Could you reflect on that a little bit more for our audience?
Right. So because this is a brand new strain of the virus, there's a lot that even us doctors don't know about it and that we're trying to figure out. What we do know is that it causes a very severe pneumonia involving both lungs and all of the lung fields. And that severe pneumonia can lead to something called acute respiratory distress syndrome, which can be very dangerous and people need to be in the ICU on breathing machines. But there's a lot that we know about this attacking the lungs and causing very low oxygen levels, which we don't understand exactly why. We also know it attacks the heart, it may attack the brain too. And we're learning about the virus as we're treating it. That's what's so challenging.
Right. And in terms of these vaccinations we keep on talking about, you know, the drugs that are on trial, what do you predict as a time frame, Dr. Purvi Parikh, you know, when we are looking at by the time we're actually finding out how we can make sure reoccurrence doesn't happen of this virus, what are we looking at right now in that time frame?
Right. So, you know, the vaccine trials have already started, which is good news. We're hoping within a few months they'll be ready for widespread use. But, you know, we always have to test things and make sure it's safe and effective. So that takes time, you know, to see if it works, if the immunity is mounted. And then certain treatments we're already testing now in sick patients, such as, you know, giving blood from recovered patients or certain antiviral medicines. Malarial medicines. Hopefully those results will have even sooner, if not the vaccine.
It's time for a short break. Stay on Vision of Asia, Voice of the Community. We'll be right back. Welcome again. This is Vision of Asia, Coronavirus Pandemic Special Report, and I am Aditi Lamba. We continue to present to our viewers more on the impact of COVID-19 Measures, updates, and insights from reputable medical professionals and South Asian doctors from all across. Dr. Janish Kothari joined us from his hospital in New York City, detailing his frontline experience as well as breaking down the situation in the ER and also providing more insight into the unknown uncertainties of medical professionals and his strict advice to our viewers. Lots of information here and also a message for fellow doctors, nurses and others. We again urge you all to practice social distancing as well as take good hygiene measures and listen in. Here is Dr. Janish Kothari via Skype. And in terms of talking about high-risk patients, Dr. Kothari, I have to ask you, since we're a South Asian network as well, a lot of the South Asian audience we've had has shown concern with, heart diseases, with lungs, issues with the lungs. We're talking about, other issues with diabetes, with hypertension, with cholesterol. We're a population that's, usually really at risk for these really high-risk issues. Your address to that community, those patients, and no matter what ages they are, they have those diseases. How do you suppose they should take care of themselves?
A lot of the reporting that's been done about chronic conditions in patients with COVID-19 are simply associations and not causations. I want to make that abundantly clear. There's not enough data to suggest that there's an actual correlation between these entities and that they make each other worse, meaning that the COVID makes their underlying diseases worse, or the underlying disease makes their COVID-19 work. There's a lot of these are observations that have been made by scientists that may be fruitful in the future if we were to investigate them more and do further research. My advice to South Asians and any other person would pretty much be to continue taking your medications that has been prescribed by your primary care doctor and keep monitoring yourself for COVID-19 symptoms, as we've discussed previously. But yes, there is an association, and that can't be denied, but it's hard to make recommendations with just the very little research that we have.
Yes, that is so true. And I think that's been the issue of the entire country right now, to just try to figure out what is working out for COVID-19. Today, the FDA approved the anti-malarial drug that's really been talked about. We've had the administration speak about it, in their press briefings. There are a lot of questions about it. I would like for you to address that real quick as well, if it's possible.
Okay, yeah. So today, the FDA they just approved it recently. So in the hospital, we've kind of been using this medication for the last week or so, or a little over a week. And this is just purely like anecdotal, based off of the mechanism of action and how the medication works, and how it's been tested, on certain patients, and when it began to happen in Wuhan, China. So some of the data that came out at that time showed that it was promising, but we still definitely need a lot more investigation on this medication. But currently, this seems to be one of the more promising interventions that we have. And on the other hand, actually, Johnson & Johnson said today that they're going to begin starting human testing for an experimental vaccine, and that's not going to happen until September, and it could possibly be available for emergency authorization and usage as early as 2021. But, there's global efforts are under the way to develop vaccine for a virus. For this particular virus, it's already killed, as of today, 36,000 people. And, but some experts have cautioned us that it can take even more than a year. And it's quite frankly, very just difficult to know when we'll have something. But it's kind of encouraging to see that people all over the world are kind of digging their hands in and doing what they can to help us.
Yeah, and Dr. Kothari, currently there are so many legislations, bills being worked on. There is, a great demand of doctors and physicians and healthcare workers from the administration and from other entities of the government to ensure that once we get out of this situation doesn't evolve again, it doesn't repeat again. Would you like to give a call out on everyone that's working out and on this bill, and what you expect as a medical professional once you're getting out of the situation?
You mean in terms of like what we expect to learn from this?
Yes.
Well, I think that in our American history, at least, this is the third or fourth major pandemic that's kind of swooped the world by nation.
Right.
And I would hope that we learn a little bit from this in terms of how to avoid certain things like this. I think that on a global scale, we need to have a better sharing of information. I just begin to wonder, like when this first started happening in Wuhan, at what point did they decide, oh, this is going to turn into some global issue? Who should we let know? CDC, World Health Organization. When should we let them know this? So I think maybe dispersing the information a bit sooner, even if it might be a little bit preemptive, would be beneficial. And if it pans out to be not a pandemic, then fine, at least we had a jump start on it. And I think that the people in administrative positions such as the government, they need to be a bit more aggressive about how they approach these things and make sure that the people of the communities that they're serving are well informed. And once again, the people that are in the community now, they need to continue to educate themselves so they can kind of react a bit swiftly if this were to happen in the future again, and continue to educate those people that are younger than them, their children, their grandchildren, whenever that time comes, like, hey, I was a part of this, you know? That's something that I'm going to personally take upon my shoulders, is when I have kids and people that are younger than me, like, hey, I was a part of this. I saw this. And when I'm training future doctors when I get older, I'm going to make sure I tell them about this. Like, I lived through this. I don't want you guys to go through this again, so do your part.
Can I ask you to give a message out to all of the patients you've been treating?
I just want to commend them for their bravery. It's difficult to see this 30-year-old patient, 40-year-old patient come in with no history, and you're ending up having to intubate them and not being able to tell them, I don't know what's going on, this shouldn't be happening to you, but here we are. We're doing the best that we can to help you. And I want to commend you for your bravery. And I want to also kind of reach out to these people's families and let them know that it wasn't their fault. It wasn't something that they could have prevented. This is kind of just the circumstances that we were in. And I appreciate all the support and effort that family members are providing us with. And there's family members that are actually coming to donate things to us even after a family member of theirs might have passed, because they knew that we did what we could, but this is sort of just a trajectory that the disease took and we couldn't stop it.
Yes, I think you are doing the most you could, and I truly appreciate you for all your works and efforts. Thank you so much for your time here on ITV Gold. Just one last question for you. How is this week planning out for you, and what do you hope out of this week as a doctor?
I stopped thinking about things and long-term goals, because when I did that last week, I was like, oh, it's going to get better, and then the cases doubled. I've started to just approach things day by day and sort of take things with a grain of salt. I've become much more appreciative of things in my life, my family, my friends, and I'm saying a thank you a lot more often, and I'm saying sorry a lot more often as well.
And this wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at our handle itvgold. Also, you can subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from our studio located here in New York City. This is Vision of Asia. I am Aditi Lamba. Take care and be well.